video calls which are being conducted by the respective organizations to their corresponding patients of whatever method or case they have been dealing with. The third is what I want all your attention on is real-time telemedicine. Now this is the game changer here. Now real-time telemedicine is unlike any other the above two that has been mentioned. More importantly, it is the live activity and it is an exact simulation of what happens in your clinic or in your hospital. So I would want to repeat, it is an exact simulation of what happens in your clinic or your hospital. Now, to do this activity, you might it might come to a point that it's easy to say, yes, we have WhatsApp video, we have Skype video, we have different softwares that are running around in the market, but this is where, since we are dealing with something called data protection and privacy, here security is of paramount importance. And this is where the two important words, which is HIPAA and DISHA, comes in. HIPAA might be familiar to some of you, which is called Health Insurance Portability and Accountability Act, which is if you have to consult telemedicine to any of the European or the US patients, this is what you have to follow, which we have been following for quite some time. The second and most important is important for you as well, which is called DISHA, which is called Digital Information Security and Healthcare Act, which is an Indian version of HIPAA, which will be implemented without much delay, and subsequently the softwares are being planned accordingly. And likewise, to add on to the DISHA and the HIPAA factor, we have some lot of personal telemedicine apps like Cogito or MD Live, then you have Healthify, etc., which are HIPAA compliant currently, but we do not have any DISHA compliant softwares as of now. Now, what are the benefits? Now, this is the core of the whole presentation. Why should we do telemedicine? Or what are the importance or relevance of telemedicine in the current scenario where everything is technology driven? What are the advantages to patients? Less time away from work. This is one typical complaint that you might be getting from your patients, that I don't have time to come and visit the doctor for a follow-up. Second, no travel time or no travel expense. Third, less interference with the child or elderly care. Now this again could be one of the major hindrances for follow-ups. The third one, privacy. Though privacy is of paramount importance coming to the security and the accountability part, but very rarely do we give, or rather patients give importance to something called privacy, which is a must or need of the hour. Fourth is no exposure to other potentially contagious patients. Now this maybe at times could be undulating kind of thing with respect to the homeopathic part, but otherwise. Now what are the advantages of the providers? Improved office efficiency, better patient flow, fewer missed appointments, because once you do an active telemedicine activity, your appointment, you do work on appointments and it never will be missed. The fourth is private payer reimbursement, and this is again the second game changer, where homeopathy is being included in a good number of the major health schemes that are being implemented or actively being implemented in India right now. And at the end of the day, it's a source of good increased revenue. Now, seeing the benefits or seeing the advantages, there are a few good challenges, and these challenges are the major issues that are blocking homeopathy or blocking telemedicine from entering into homeopathy in particular. The first is difficulty in developing the clinical champions. The doctors or the professionals or the homeopaths rather, along with the patients, have to be convinced and they should be aware of how this should be done. And to do this actively, we need to have an uninterrupted flow of broadband or internet activity that is happening around. And most importantly, which is a dilemma or which is a major problem among the fraternity in general, is fear of new technology. Anything new is a problem. Now to conclude, this is going to be a revolution which is specifically in the rural primary healthcare. And the next paragraph I would want you to focus, this is an international data that is available, which says that the compound annual growth rate of telemedicine implementation has risen by 18.5%, and it is going to substantially rise in the year group starting from 2018 to 2023. Now, it initially started as telemedicine, which is simple consulting and prescribing. The second step, which is currently evolving, is telehealth. And the reason is patients do not contact us only for medicine or consultation. A simple advice or a simple note from a doctor is counted. And the third and most important, which is called the AI health, which is called artificial intelligence in healthcare. It is the booming one revolution that is going to happen, which is called the scope of the, or rather the stethoscope of the 21st century. I had a few examples, but I will just cite one example of AI health, where currently you do not need a doctor to diagnose a case. So these are a few testimonials, and at the end of the day, I request all of you to join hands together to implement telemedicine and make it accessible, affordable and advantageous. So I'm pretty sure that together we can do it. And thank you.